We continue to help get you ready and properly trained and prepared for the upcoming bridge run, continuing the conversation today to prevent any injuries from the race. Dr. Adam Brown, a board-certified podiatrist. We've highlighted some of the common injuries, and now we have to highlight the proper footwear, because if you don't have the right shoe, that can lead to many of these injuries.
Absolutely.
But there are so many choices when you go to the store. So what exactly should you look for when you need to find the appropriate shoe for you?
Yeah, I mean, the most common thing I do with people that want to start running or want to start getting in shape, even exercise, walking, is send them to a specialty running store. We probably have 3 or 4, or maybe 4 or 5 around Charleston, both downtown, West Ashley, Mount Pleasant. So the first thing I do is get them in there for a quality running shoe. I never like to put a price tag on the running shoes, but you probably need to spend $65 or above, somewhere in that range, to get a quality one. And then the key to it is really replacing them at the proper times as well, because they do start to bottom out and wear down, and your body and your feet will start to feel that.
And we're going to talk about the importance of replacing your shoe. You can't wear your running shoes until the soles fall off. We'll get into that in just a moment. But first, let's talk about the 2 different kinds of shoes. One of them is the cushion shoe, and the other one is the motion control. Tell us the difference.
It really has to do with foot type and the mechanics of the foot and how the foot functions. When I see people in the office and we get x-rays, obviously it's very easy to see that. We can see the bones and the structure. And people are split up into basically 2 different categories. Either a normal, neutral type of arch structure, or a high arch. And then you have the low or the collapsing type feet with very low arches, almost close to the ground. So what we see here is a picture of a cushioned running shoe. It has more of a rounded portion to the front of the shoe. It's made with more cushion up in the front part of the shoe and the back. And it's really there more to absorb shock for the person than anything else. Now we look at the motion control shoe, and you can see the change in the bottom portion. It's a little wider. It's also a straighter look to it. And you can see on the back part of the shoe some different coloring of the padding back there, and it's firmer. And what it's made to do is actually push your foot back over some. It's actually made to actually give you more support to protect sort of that collapsing arch area.
And will you know immediately that the shoe is right for you when you really put your feet in and you lace them up properly and you take a little jaunt around the store? You will know if you need a cushioned shoe and you get into a motion control shoe, yes, immediately you'll feel that it just does not feel very comfortable. When you get a new running shoe, it should feel comfortable right there in the store. I usually recommend to most of my patients, take them in the house, wear them for a couple of hours first before you wear them on the road, but they should fit well immediately. Now to the importance of replacing your shoes when necessary. Let's talk about that, because I'm sure that you have seen, as a podiatrist, people who wear their shoes for way beyond its lifespan. Absolutely. The rule of thumb typically is to replace, if you're a runner or even a heavy walker, to replace your running shoes every 4 to 6 months. That somewhere equates to maybe 400 to 500 miles on the shoes. If you're working in the shoes and you're not wearing them too much to run in, you probably can get 8 to 10 months out of a shoe, but once you get past that, if it's a shoe that you wear regular, it's going to start to bottom out. Again, you'll start to see some overuse injuries in the feet for sure, and it'll usually send you in to see me. Right, because if you wear your shoes too long and you've worn down the cushions, because it's not what the shoe looks like on the outside, but it's the support on the inside, correct? Correct. And if you continue to wear your shoe after it's lost its support, then it would lead to some injuries. Like the last one we talked about was plantar fasciitis. And talk real quickly about what some of those symptoms are like for this injury, because it's one of the most common ones, and it can be caused by wearing the wrong shoe. Without a doubt. As the shoe starts to bottom out, as you lose the support, you're going to get increased strain on certain areas of the foot. The most common part of the foot to take that strain is the plantar fascia. Now, as that starts to break down, you get the most typical thing I see or hear from patients is the morning time. They get up in the morning, they get out of bed, they can barely put their foot down. It does loosen up as they get going a little bit, but they really can't figure out why. They don't remember doing anything, and all of a sudden the pain's there. Again, as the shoe starts to wear down, increased strain goes there, it breaks down, and
you can, again, the morning pain is the most common one I see, but also getting up from being seated. You can go to lunch, get up, you feel it, you get out of the car, you feel it, so that's the heel pain, that's the plantar fasciitis starting.
Yeah, some might say, oh gosh, it feels like I'm stepping on a rock.
Yeah, without it, and that's the inflammation down there.
Well, now let's talk about, back to the footwear. Some people can order orthotics for their shoes to help them have the proper support that they need, correct?
Correct. If there's a biomechanical fault, if the foot is not functioning in a normal fashion, we do custom orthotics at the office where we take basically a 3D scan of the foot and we put it into the running shoe. And basically it supports or neutralizes the foot to take some of that excess strain off of those areas that are getting it with poor biomechanics.
Yeah, and each podiatrist in the community might offer something a little bit differently, but you talk with your doctor and see what's best for you,
Exactly,
right?
exactly.
Well, what about the importance of wearing the right sock? Because you have to have the right shoes, but socks are important too.
Another common thing I hear soon after the run or at the end of the training are blisters. Blisters on the foot, blisters on the toes, and yeah, socks, I think the old adage was that cotton socks breathe and they're better for you. Definitely not the case. A mixed fiber sock, one that has nylon, polyester in it, and usually there's a cool max fiber in it. Usually you see that on the tag. It just has a way to basically absorbs the moisture off of the foot, so it allows a lot less rubbing, which leads to less blisters and less irritations.
Yeah, because after 6.2 miles, you are bound to get a blister if you're not wearing the right sock.
Absolutely.
That's for sure.
Yeah.
What about warning signs that you're pushing your body too hard during the race or during training?
Interestingly enough, a lot of times you will not feel it during the training. I mean, if you haven't trained at all, you might, run into some tough times when you're on the bridge. But typically, you'll feel it the next morning. You will train. The run will usually be okay. Your body gets warmed up. And then as you go to sit down, or definitely as you wake up the next morning, that's kind of when these things start to creep in. You start to have trouble, and that's a true sign that you overdid it the day before.
Well, coming up after the break, we're going to talk about the healthy training tips that you need to know if you plan on running or walking in the bridge run. And even if you don't plan on participating in the race, stick around because Dr. Brown is going to also give you some general tips on how to just get you back on your feet again.